have to share a picture that just came across my cell phone. It's going to be a weird picture, people. This is the Chanin Mast team at Morristown. There it is, all dressed in red, has the red masks on, all for HCM Awareness Day. Yay, team. Well done, Matt.
I just took off my red mask, Lisa.
Okay.
So yeah, I'm going to give you a highlighted video version of that. Thanks for joining us. You and I can't get away from each other. All we do is spend time
I just
together.
lost you there for a minute, Matt.
Come
on back. What would you say?
I'm still here.
Okay, I lost you there for a second on audio.
You and I can't get rid of each other. We spend tons of time together this month.
We have, and I mentioned this a little bit earlier. We did a media tour. So Matt was my guest and he was my guest or I was his. I don't know. We did it together.
I think I was your guest.
I don't know. I think I was yours. So he did the medical, I did the patient, and we did 25 interviews back to back to back to back to back to back to back. I didn't do 25 because that would just sound silly. And as of this morning, I understand we have over 25 million impressions. And we have to thank BMS for helping fund getting that out there, that whole media tour thing. So thanks, guys, for your support of raising awareness of HCM. 100%. And Matt and I talked an awful lot. And by the end of the day, we're like, HCM, what? Do we really? It's a little much.
It was a great day. It was a great day. And I think many of those are still being shown today, right? I still think there's
some of them are airing just today. So yay.
Well, thanks for having us. We are excited. I'm going to do a little bit of a slideshow. I trimmed it down watching other folks do theirs so that if the case there's any off the cuff things we need to talk about. But thanks for having us. We're having a crazy day here. Everybody's in red. We got masks that are red. We brought some food in for the staff because, as you know, and man, they work hard. They work overtime. They work often. They're calling people back. I'm calling them at crazy hours of the day saying, I'm sorry, I got to add another one.
So team, next year, HCMA Day, HCMA Day, both. We're going to send little gift boxes out and they'll all open them at the same time.
Love it.
My team loves when I do this. I'm like, put a pin in that. That's a good idea. So team, next year. Okay, well, Matt, it's all yours. Want to do a screen share?
Yeah, let me get a little share action there.
While you're talking, I'm going to be on mute with my camera for a minute because I have to go get something to drink.
Now, can you see the one that's full screen before you go?
I can. You are good to go. And I love that you used our artwork. So thank you.
Well, fantastic day. And thanks for having us involved. I'm Matt Martinez. I'm a clinical cardiologist. We're going to talk about what our program looks like. I'm the co-director of the Hypertrophic Cardiomyopathy program and the director of the sports cardiology program from Dr. Bach. You just heard about Mustafa Husseini, who was one of the FITs when I was the chair of our section. So we knew Mustafa well. They're in good hands out there in St. Louis with that team, and he's a great addition. We are located in the great state of New Jersey. We are right near Lisa, which is fantastic. That connection has been fabulous. It's densely packed New Jersey, as you know. Anybody who's been driving through here, COVID opened up some roadways, but they're filling up again. We are easy access to New York City and Pennsylvania, and we see lots of folks from there. I actually have my license in New York, PA, of course, New Jersey, Florida, and several other states to allow some of that follow-up, which can be a challenge. If you travel hours and hours, it's nice to maybe get a phone call back where we can video through and I can show you some images. We're at Atlantic Health and Morristown Medical Center. The big center, the flagship is in Morristown, and that's where we're located, right across the street. You may know us for our cardiology expertise in other stuff, cardiac surgery and TAVRs, and we'll talk about those teams in a minute. But the HCM program has now really taken off. And in 2014 is when it got started from a grant from the Mast family. Bob and Terry have really been champions for this locally in our institution, starting the Chanin Mast Hypertrophic Cardiomyopathy program. And we're the only one. We're the only named program, I think, in the world, certainly in the United States. And we are the only program currently in the state of New Jersey. And we continue to grow on a regular basis. Now, this is our team, and that's why I'm the co-director, because the team is big. It includes those, Marty Marin and Ethan Rowan, who started the program in 2014 in a collaboration with Morristown Medical Center. And Deetra DeBose is our nurse practitioner, and she has been with us since the beginning. And it's been slowly growing to the point where I was asked to join them in 2019, which is when everything sort of changed for me. I left the Mayo Clinic about 12 years ago after training there and then doing some HCM program time with them. Started another program in a different state, and now many of those patients have come with me. And now we're building an exceptional center here in New Jersey where we offer a weekly clinic, an inpatient, and expansion of services. And Lisa has been guiding us along the way and pulling some of the strings to get Dr. Martinez to drive an hour and 20 minutes every day. Totally worth it. We are a center of excellence. We do everything. We manage athletes and we handle all of these things. Some are still evolving and growing, but our team is quite amazing. And this is the picture you just saw.
Oh, awesome.
We have a unique program, right? I'm in the back here and surrounded by all of these women in the front who keep me in line. And they do a phenomenal job. Many of the group here has been with us from the beginning, but as we've grown, this picture is going to get harder to take, Lisa, over time. It's doubled and tripled and 5-6 times where we started when it was just a couple of us in a small office with Marty and Ethan coming down just a couple of days a month. So it's not alone. We clearly do this as a group, right? Our imaging department is superb. Seth Uretsky runs that, continues to expand. Over 2,000 cardiac MRIs done on a regular basis here, on an annual basis here at Morristown. Our arrhythmia team is always available. They're collaborative. We talk a lot about how to manage folks. It's been amazing. And our interventional team, you probably know. Your cardiothoracic team, you probably know from other scenarios. And now Dr. Van Boxtel, who has specific focus and interest on myectomy, has joined us, and that experience continues to grow, along with the collaboration with Marty and Ethan, so that we can still have this opportunity to share patients and make sure that patients get the right procedure for the right individual. We do research and we love it. We just enrolled our last patient because the study is closing for this Novartis study in a couple of weeks. And then Sequoia, I believe, is getting started soon and moving right along. We have a great collaboration with Tufts Medical Center and Atlantic Health, and we've done that since its our inception in 2014. Thank you, donors. Really important. They have helped support this and allowed us to continue to grow this. And then both Marty and I were involved in the guidelines. Much of that data came from collaboration from the Tufts database and ours to help grow some of the experience with that. And then a recent publication about some disparities in hypertrophic cardiomyopathy. We're getting better at that. We get a new focus coming for that in the next year or so. Now, these next two topics are really my passion. Education is really what drives me. We were involved a little bit in the International Summit. We've done some clinical spotlight series to try and improve our ability to recognize HCM, both with the ASC, the American Heart Association, and the American College of Cardiology. Has been intimately involved with some grant support to try and drive an accelerated care. Now, Lisa was involved in this. She was involved with a heated panel with many of the folks that are talking today, but we're trying to get better at recognizing this so that we're not missing 85% or more of those with hypertrophic cardiomyopathy, either an underdiagnosis or an overdiagnosis. And then my last passion is really on safety. Whether you're an athlete, you're in the stands, you're an exerciser who is just doing your mild to moderate exercise for hypertrophic cardiomyopathy, hands-only CPR and AEDs are critical. And Bob Lorfink has been a huge champion for us to help support this. I just got back from Dallas. Last night at 1 o'clock in the morning, I flew down there and helped train the professional referees organization, PRO, so that they could be available on the field for soccer at all levels. But this is really an exciting piece for me. We're giving away defibrillators. You may see our next giveaway back here, the Zoll back there on my shelf. That's our next one to give away. Folks who need this, who can't afford it, who need some additional education and support. We are pumped to try and deliver this in the tri-state to try and improve safety, whether you have HCM or not. So that's it, Miss Lisa. And I see you're back from your drink break. I'm excited to just continue this conversation. Thanks for having us. The centers have been amazing. It's really quite a cool group to be associated with.
It's a very cool group to be associated with. And I'm sorry about the little like minor chaos here. For some reason, if I mute my mic, I mute everybody today, webinar weirdness. And there had a little coffee mishap here. So my extra coffee, it was leaking. My cup was leaking. And I just turned around and there's like water heading towards the soundboard. So I got a little freaked out. So sorry about any noise in the background.
All good.
We are all human and someday we'll be perfect, but today's not looking perfect for me. Okay. So Matt, you brought up some excellent points. I love the focus on CPR and AEDs. You know, it's the duh moment. I can remember back in the late 90s, I went to the school boards and I said, you need AEDs. And they looked at me and thought I was crazy. Rockaway Township had brought it on in Rockaway Township, New Jersey, brought it on in 1999. And it took me to 2002 to get the high school to come on board. But we've been on board for a long time here and they've been used successfully in the Hills District, Morris Hills Regional District. They have, and I don't know about the grammar school, but we were talking about this 20 years ago and we still have so much work to do.
Yeah.
Still so much work to do.
So I try and focus on it still, as you know, it's the final common pathway. We can have a fist fight over EKG screening or management or who gets what, but the reality is this works. It works well. You got to have them close. You got to get a little bit of training. It's easy to do. I tell people you ought to be able to drive a stick, do hands-only CPR and an AED and learn how to swim. Those are the three things you ought to finish high school with. I'm still working on it on my kids.
I don't know. I'm not sure. I don't know that all of mine can. I don't know about a stick on all of them, but I can do it. So.
Me too. The stick's getting harder.
It ain't pretty. It ain't pretty, but it can be done.
That's right. That's mine as well.
So your team is amazing. And there's a soft spot in my heart for Morristown because like it's my town, my community. And probably now, again, I'm going to feel old. What's it, about 18 years ago? I said, don't come to Morristown, Matt. We're not ready for you.
You did. That's correct.
And I said, it's not ready yet. We need some work here. And the work happened and it all came full circle. And here we are with a fantastic program, very comprehensive, lots more to come. And you're right down the street from me. So I know where my family can go. So thank you. And thanks the whole team.
Thanks for doing all you do. As you know, I tell people we're the most watched program in the country. If Lisa needs me, she comes right down the street. So we are happy to collaborate with you. The more we do, the better people do. So we're excited.
So it is kind of funny. Like I don't think I've ever actually walked in the door, but I've thought about it. About it. I will want to give another little shout out here because we're not going to talk a lot about some of our new committees later on in the day, but Deirdre DeBose, your nurse practitioner extraordinaire, will be joining the HCMA's Health Equity Committee moving forward. So we're really excited to have her on board for that, and a number of other individuals will be joining. But we need to really start focusing on this problem of health inequity in HCM and start to balance the playing field a little bit. So we're really looking forward to working closely with Deetra on this. So thank you for sharing her talents with us. And it's no secret also that a member of your tribe is a member of our tribe. So you hire from within the big-hearted community, and we thank you for that. So
we love her. She's a great addition. It's there's nothing like street credibility when someone says, well, you don't understand. And she says, well, I kind of do.
I do. So thank you. Shout out there. And that's about it for us today. I think we've spent enough time sitting in Zoom rooms. So it's going to be a dinner soon. Agreed. So we can see human faces. And now we're going to go to some pre-recorded sessions from the other side of the country. We're going to hear from Utah now. So Matt, thanks for everything. Thanks for your partnership and thanks for being part of HCM Awareness Day.
You got it. Thanks for having me. Bye-bye.